I recognize the member for Markham-Stouffville. You stood up. You stood up. I thought you wanted to speak. I regret. I recognize the member for Mississauga Centre.
Merci, Monsieur le Président.
Thank you, Mr. Speaker. Good morning.
Pleasure to rise today with the opportunity to speak in support of Bill 74, the proposed People's Healthcare Act. This landmark legislation promises to put Ontario patients first and bring an end to hallway healthcare. And for that, I wish to thank our Deputy Premier and Minister of Health and Long-Term Care, who has worked tirelessly to protect and transform our healthcare system to put patients, their families, and caregivers at the centre of care. I wanted to say a special hello to my nursing colleagues at Etobicoke General Hospital who are watching right now and have completed their morning patient rounds. You are doing an incredible job being the backbone of our healthcare system and caring so selflessly for our loved ones. Mr. Speaker, I'm not sure how many here will recall their maiden speeches, but I certainly recall mine, as it was a monumental moment in my life and a very personal one. I remember it because it was so much more than just a significant occasion. It was the first time I shared with everyone here my background as a registered nurse and what motivated me to become a member of this Parliament. I spoke about the realities of hallway nursing and how I have had to treat patients in overcrowded and narrow hallways, public spaces in which their privacy and dignity are non-existent. I told the story of a young woman who had miscarried her unborn child in a hospital waiting room in front of dozens of strangers because we had no rooms or beds to put her in, because we were experiencing a service gridlock. As my colleagues can certainly attest, this story is not unique and was not a singular occurrence in our healthcare system. Nurses like me carry similar stories about their patients each and every day when they report for duty at the crack of dawn, when most of us are still in bed or just waking up. Inadequacies, misaligned priorities, lack of foresight, and burdensome and expensive bureaucracy is what had led our healthcare system to fail that young woman on one of the most difficult and tragic moments of her life. The healthcare system was troubled then, and although progress has been made, much work remains. Mr. Speaker, I remember my maiden speech today because in it I pledged to the people of Ontario that our government would work tirelessly to do whatever it takes to end hallway healthcare, to end hallway nursing in Ontario. Our leader and our team made a pledge to the people of Ontario during the campaign. Ending hallway nursing was, and still is, one of our most important priorities. And Mr. Speaker, our government has moved remarkably quickly on keeping that promise, which is why I'm so proud to be standing here today, only 8 months later, supporting Bill 74, the People's Healthcare Act, and commending our Deputy Premier on her unparalleled commitment to ensuring we have an accountable and well-integrated system centered around the patient. A system that is efficient and reliable in its delivery of healthcare, and more importantly, sustainable for future generations. Because we need our healthcare system to be here for Ontarians today, not just today, also tomorrow, but also 10, 20, and 50 years from now. For patients, one can only imagine how frustrating it is not to be able to receive the care you need in a timely manner, to have to wait for hours on end before seeing a physician, and once you are finally called, to be treated in a cramped hallway for everyone to see. It is mentally and physically exhausting to have to retell your medical history over and over to every new care provider you meet, or to be given the runaround in finding and understanding the services that you need. Patients already endure the discomfort of their symptoms. Why must our healthcare system make their lives even more difficult by being so disconnected? We live in the 21st century, and technology is our friend. We have instant access to so much information, and we can connect people around the world. But for some reason, in our province, we still can't access our own health records. Not even our healthcare providers are able to see the full picture of our medical history. Bill 74 will change that. This legislation will put patients first, by giving them the option to securely access their digital health records whenever they need it, to seamlessly view all available healthcare providers and book appointments online, or to speak to a specialist virtually. It will also put healthcare providers first and result in large cost savings when physicians will be able to log in and review their patient's entire health history. The need for repeat and redundant tests will decrease. Speaker, how is it possible that in the 21st century, Ontario does not have one streamlined platform where all our healthcare records would be housed? Some institutions and care facilities have recognized this need a long time ago and took it upon themselves to develop such platforms for their patients. This demonstrates the incredible leadership we have in our healthcare communities. However, the situation is now that there are multiple platforms across healthcare institutions in Ontario which do not talk to each other and are not integrated. In practical terms, what this means, and I've seen this firsthand, emergency physicians in Toronto or Peel must try to log up to 5 different platforms to look up their patient's history, previous lab tests, or diagnostic results. In addition, family physician health records are not available to physicians in hospitals. Speaker, in emergency and trauma situations, having quick access to previous health records can make the difference between life and death. Our institutions simply cannot do this alone. They are looking up to the government to lead this healthcare transformation and finally develop an electronic healthcare record which our patients and providers need and deserve. And hopefully, once and for all, put our hospital fax machines out of business. Le projet de loi 74
Bill 74 will create health teams that are community-based, made up of a range of healthcare professionals, and they will be able to coordinate their work and increase their efficiency by maximizing support to patients, all the while eliminating useless bureaucracy that wastes our resources. Mr. Speaker, 42 cents of every taxpayer dollar are used for healthcare. We must maximize our investments from taxpayer funds within our public universal healthcare system.
Right now in Ontario, there are simply too many agencies, oversight bodies, and service provider organizations that fail to seamlessly provide a unified approach of health services. This fragmented collection of health organizations only serves to confuse patients and delay their treatments. By its very nature of being so poorly diffused, the current system lacks accountability. Over the last 15 years of liberal government, we've had to witness our healthcare pulled apart in a number of different directions. We've had to sit and watch the creation of disconnected agencies working towards promoting patients' health without any sort of coordinated vision. It's a broken system that makes no sense, and it's precisely why our Premier created the Council on Improving Healthcare and Ending Hallway Medicine, so that we have the necessary professional expertise to develop the most accessible, accountable, and sustainable solutions. Speaker, just last week, I had the opportunity to work an ER shift, which I do on occasion in order to maintain my standing with the College of Nurses and my professional registration. And I worked the infamous hallway shift. 10 patients came through my care that day, stuck in a hallway bed for hours or days for some of them. A broken hip, pancreatitis, altered level of consciousness, dementia, internal bleeding, chest pain, and even a bomb blast wound, to name just a few. Very few of these patients were what we would call hallway appropriate, but they ended up in my care simply because there was nowhere else for them to go. Speaker, every day in Ontario, healthcare professionals like me put their license and safety on the line when they show up to work in our fragmented and mismanaged healthcare system. Our proposed legislation, Bill 74, will change that. It will create a better connected system, one single agency, Ontario Health, that will facilitate a seamless delivery of services under one harmonized vision. Through a carefully planned, holistic approach, this legislation will establish in phases Ontario Health teams that are able to provide a coordinated response for patients that ensures smooth transition between care providers. Instead of a system that works in disjointed silos, we'll have Ontario health teams that bring together local healthcare providers, hospitals, and mental health and addiction services, all under one more modernized and cohesive agency. Speaker, in practical terms, this means that when I discharge my patients from the emergency room, I will not have to worry whether their CCAC or care coordinator will show up in time to provide the home care that they need, because the care will be centered around the patient and not around the brick and mortar in which they happen to find themselves in. This is a much-needed change. The Premier's Council issued a report recently. In it, they listed a number of flaws, such as how difficult it is for patients to understand and navigate our current health network, and how Ontario needs a system that maximizes value for money through increased efficiency and coordination. Speaker, some patients actually hire patient advocates to come to the emergency rooms and to help them navigate our healthcare system. That's how dire the situation is. Our government is listening, and it is acting. Our government is listening to professionals. We're taking the advice of doctors, nurses, and frontline care providers. And most of all, our government is listening to the patients. When I say our government is listening, I mean that we're doing it in multiple ways. We're not just holding meetings with professionals. We're going out into our local communities. We're having conversations with constituents. We're visiting our hospitals and seeing for ourselves what our current healthcare system looks like. Every day, we're hearing stories from doctors, nurses, pharmacists, porters, technicians, dietitians, physiotherapists, and all healthcare professionals, as well as our patients, about our healthcare's current state of despair. The mother of one of my staffers is a nurse that has worked in several hospitals. He asked her if she has any stories about hallway healthcare, or hallway nursing, as I like to call it. She replied, asking if he wanted to hear the good stories or the bad ones. Confused, he asked what she meant by good stories. After all, how can any hallway healthcare story be a good one if the minimum standard for quality care is for patients to be treated in private rooms? She explained that the good stories are when they actually have room in the hallway to treat all the patients. Speaker, what does this say about our healthcare system when Ontario's nurses are telling us that a good hallway healthcare story is when there is enough room in a hallway to place a patient? When asked about the bad stories, she spoke about the complete lack of privacy and dignity patients must endure. She spoke about how normally patient rooms are equipped with proper beds that can be adjusted so that patients can sit up or lie down comfortably, but how in the hallways there's only enough space to have the most rudimentary of stretchers. She spoke of having to treat senior patients, some of which are unable to walk, and how they needed to be changed in the hallway because there is no available rooms for them. Imagine, Speaker, having lived your whole life with respect and dignity, only to have it robbed from you in a hospital hallway as people walk by to see you being changed. She spoke about patients not having the privacy they deserve to hear their diagnosis, some of which are heartbreaking, or to be able to speak privately with their families about their healthcare decisions. Again, Speaker, I ask you to imagine finding out you have a terminal illness and wanting to make final arrangements with your family, wanting to spend time with them in peace, only to have to be interrupted by the constant traffic of people walking around you, hearing your most intimate and private conversations. These experiences are heartbreaking, but they are the realities of Ontario's healthcare system. These patients are already going through some of the most painful and stress-filled times in their lives. We cannot let our system continue to function like this. We simply cannot. And this is why our government has acted so quickly in its mandate to address these systematic problems. It is why I am so proud to be a part of this government that is creating 6,000 new long-term care beds towards a total goal of 15,000 over the next 5 years. I'd also like to address some of the criticisms we've been hearing from the opposition about our new plan. And I'd like to do so by asking them, when was the last time they were a patient in a hospital? When was the last time they were given medical treatment in a hallway? Because if they haven't had gone through the long wait times and be treated in narrow, overcrowded hallways, then either they're in really good health or they must be getting their health care somewhere else. Because the unfortunate truth, Speaker, which our critics fail to appreciate, is that having to wait for hours just to be treated in a hallway has just become the new norm. And so, I'd like to encourage all the members opposite to support Bill 74, because in doing so, they will also be supporting Ontario's healthcare providers, and most importantly, supporting our patients, families, and caregivers. I'd also like to thank again our Deputy Premier and Minister of Health and Long-Term Care, who has lived experience as a patient in our healthcare system and has been Ontario's patient ombudsman for 6 years. She knows better than anyone the kind of changes that are needed to make sure our healthcare system becomes accessible, accountable, and sustainable. Speaker, I am looking forward to the day when hallway nursing becomes a thing of the past and the dreaded hallway shifts are no longer. This is my wish for all Ontarians. Thank you, Mr. Speaker.